At a GP surgery in Swansea this morning, a vaccine clinic for the over 80s.
Right, what's your name, young man?
Ronald.
Edwards?
Edwards.
The practice has 300 patients over 80. They'll vaccinate nearly 100 today.
Are you ready? 1, 2, 3. Super duper.
It's got to be done. It's not for me. So like to everybody else.
Oh, bless.
How are you feeling about it today?
I think we are very excited that today is the day that we are giving the vaccine to the over 80s.
Can I ask you what happens if someone doesn't turn up today for an appointment?
So if somebody doesn't turn up today, we've got a backup. We've got a list of patients to contact where we would ask them to attend, and also we've got our A&P doctors and nurses that will go and do the housebound.
Which vaccine is it?
It's the Oxford vaccine.
Right, okay.
Okay? Is that okay? Yeah.
But even as the UK clocks up more than 3.5 million first doses administered, restrictions tighten over concerns about new variants of the virus being imported. From 4 a.m. on Monday, all travel corridors close. Everyone arriving in the UK will need to self-isolate for 10 days, shorter if they have a negative test after 5 days. It's yet another blow to an already beleaguered aviation sector.
What we're looking for now from government is a clear roadmap out of these current restrictions. We understand why they're in place. We're in a health emergency, but for a sector that hasn't been able to fly for the better part of a year, we need a clear way that we can hopefully enable some meaningful travel over the spring and summer period through things like through testing and taking into account hopefully the positive impact of vaccine rollout.
These new rules should have come sooner, said Labour. Others questioned how stringent enforcement will be. Travellers into the UK will also need to present proof of a negative test before boarding. And to the travel sector, the government had this message.
The most important thing for all of the travel industry is that we're able to get people out and about travelling again safely as soon as possible. And it's what we're doing with the vaccine, the massive rollout of over 3.2 million jabs. That's what offers the real prospect of better times for the aviation industry and the whole of the travel industry.
But there is a long way to go. The UK's daily infection rates have fallen, but still almost 1,300 new deaths were reported today. These images were taken last night in intensive care at the Grange University Hospital in South Wales. They've yet to see admissions decline, said one of their consultants, who this morning sent us this update.
Quite a sad weekend so far already. A couple of deaths overnight. It's probably been one of the hardest things recently at the moment. The death rates are worse this time in ITU. Not all over, so the hospital death rates I think for COVID are much better because the steroids and some of the oxygen therapy are working really well. But it means that patients are failing that by the time they need us. So they are, the sickest of the sick. They haven't done well with the therapies that have turned everybody else around. So it's quite hard keeping staff morale up.
Which kind is it?
Pfizer.
Pfizer. Good.
From vaccine clinics in Swansea to Salisbury, the city's cathedral this morning hosted 5 local GP practices. And in this ever-expanding rollout, in this most striking of settings, another 1,000 were vaccinated. That was the scene in Salisbury. Meanwhile, in Glasgow today, the temporary hospital, the NHS, Louisa Jordan, saw 5,000 health and social care workers vaccinated in what's thought to be the largest mass vaccination clinic in the UK to date. So the pace of the programme is picking up, but the challenges are all too apparent. The Welsh Government today said that one of the 4 batches of the AstraZeneca vaccine, around 26,000 doses, it was due to get next week, has been delayed by a week, and that the rest of the UK was affected. We haven't had confirmation of that from the other UK governments, and the Welsh Government stressed that it would still be hitting its targets. But we also had news today of delays to shipments for the UK and other countries of the Pfizer vaccine. The company said it was upgrading its production systems, and the UK government again said it wouldn't affect its mid-February vaccination goals. But all of this illustrates clearly just how much volatility there is right now in this all-important vaccine supply chain.
Andy Davies. Now, as the UK institutes tighter travel restrictions, it's worth remembering the country that brought in the strictest controls before any other was New Zealand. While some here were floating the idea of mass infection leading to herd immunity, New Zealand went hard and fast into lockdown at a time when there were only a few thousand known cases worldwide. They have had just 25 deaths in total since. I'm joined now by the epidemiologist, Professor Michael Baker, who helped devise New Zealand's response. He was speaking today at a conference organised by the UK's trade union-backed Zero COVID campaign. Thanks for joining us. When you mention New Zealand in this country, quite a few people will say, oh, well, they're a remote island nation with a population the size of Scotland. It's totally different to anything in Britain. What would you say in response?
Well, greetings from New Zealand. I would say in response that actually this has become the dominant approach, that is elimination, in many countries in Southeast Asia and in the Pacific. I mean, it's working in countries like Vietnam with 100 million people. It's working in mainland China with 1.4 billion people. So it doesn't depend on being an island. It can work in almost any setting. It just requires a commitment from the government, strong leadership, to try and achieve zero cases. Now, it's important to remember that you don't always get to zero, and you will have setbacks. New Zealand's had outbreaks, but actually, the countries pursuing this approach are doing very well from a population health perspective, and also they're protecting their economies, and they're all recovering much faster than countries that are trying to live with the virus.
Britain seems to be putting all its eggs in the vaccination basket while doing what it can now on Monday to shut down international travel, bringing in new strains. Are we now doing everything we can, or is there still more that we could do to try and get somewhere near you?
Yeah, look, I think the UK has all of the resources necessary to pursue a zero COVID approach. You're managing your borders, that's number one. You have track and trace to follow up cases and outbreaks. And the third thing is you have the tools to dampen down transmission. That's mass masking and requiring people to stay at home for a period of time, so a lockdown. And now you have another tool, which is vaccination, which will make it easier to achieve this. But by doing that, you will hugely decrease the number of people who die over the next few months.
Right, so how important now is the test and trace thing? Because we don't hear a lot about that, to be honest, in this country now, because everyone is excited about vaccination and there's a rush to get everybody vaccinated as quickly as possible. Do you still need to have the same priority on test and trace once you've got vaccination going?
Right. Well, it depends. If you want to pursue a rapid decrease in mortality, you have to do everything you can at the moment. And of course, vaccination is a remarkable development, and that will be one of the main exit strategies globally. But in the meantime, you have a lot of people who will die unnecessarily unless you pursue a zero COVID approach.
And is the... sorry to interrupt. I just wanted to ask you about, is New Zealand actually, though, risking not being able to rejoin normality at the same time as everybody else by not pursuing vaccination with the same haste as countries like Britain and America and now India? When we're ready to travel, you won't be letting us in.
Yeah, well, New Zealand has a plan to achieve high vaccine coverage over the next few months. So we're pursuing the same approach as elsewhere. But of course, we recognise our need for vaccine is not as urgent as the UK and North America and Europe and many other countries. So we're happy to be slightly further down the queue. But we will be having vaccine for arriving in a couple of months, and that will be given to the frontline health workers and border workers and so on, very much in the same way Australia is also pursuing vaccination. So we will get to the same point as everywhere else.
Professor Baker, thank you very much.
Thank you.
Now, Uganda's President Yoweri Museveni has won a 6th term in office after an election that has been marred by violence. Museveni maintained his grip on power after 35 years in office by winning nearly 60% of the vote. But his challenger, Bobi Wine, urged people to reject the result, saying it was the most fraudulent election in the history of Uganda. Our international editor, Lindsay Hilson, reports